Hi, I'm Lorena.
And I'm Payal.
And today is NICU Nurse Day. And so we wanted to take some time to give you some information regarding some of the things that we do in the NICU.
Can you explain what a NICU is and what a NICU nurse does?
So a NICU is a Neonatal Intensive Care Unit that specializes in the care of ill and premature newborn infants. And a NICU nurse is usually a licensed registered nurse who works in collaboration with other NICU doctors, nurse practitioners, and other nurses in the care of these ill or premature babies. They're primarily responsible for monitoring vital signs, administering medications, treatments, nutrients, and of course providing that care and comfort for our newborn babies.
So what are some of the common reasons that you see babies in the NICU?
Some of the common reasons are prematurity, which is usually 37 weeks or less, TTN, which is transient tachypnea of the newborn, usually they're breathing fast, respiratory distress syndrome, hypoglycemia, which is low blood sugar. Another reason is probable sepsis or infection, maternal chorioamnionitis, and usually that's an infection of the inflammation or infection of the placenta.
So what's the best part about being a NICU nurse?
I think one of the best parts is knowing that every little thing that you do, big or small, for your infants is making a difference to make that baby healthy. The bonds that you make with your families and your parents, just seeing those smiles and those tears of joy when they get to hold their baby for the first time after getting off a ventilator or the oxygen, and just seeing that anticipation and excitement when they finally graduate from NICU and get to take their baby home. Mm-hmm. So I think those are some of the best parts of being a NICU nurse.
So when babies are in the NICU, what do the families do?
So the most important factors is parent bonding. We want to make sure that the baby and the parent, mom and dad, both get to spend time, so we don't limit that. They can come in and visit 24/7. When the baby is stable and ready, then we do encourage skin-to-skin contact, kangaroo care. They start getting involved in all of the care as far as diaper changes, feeds, burping, and of course we educate them along the process when they need it. And of course, pumping is very important when they come. They can pump or breastfeed, and we just want them to be able to really participate in the care of the baby and in all the decision making.
So what's the best way to support a family who has a baby in the NICU?
So I think it's very scary to be expecting a healthy newborn baby and end up with a baby who's in the NICU. So the most important thing would be to calm their fears, because it's just a scary experience and you don't want to go through that. So it's important. You can do this by including him in the care of the baby, by educating the parents about everything that's happening, educating about the equipment, the processes, the procedures, and always updating them on the plan of care on a daily basis so that they feel that they know exactly what's happening every step of the way. And just being that shoulder to cry on when they feel like, oh, my baby's not doing well. I just hope and you can pray with them. We've prayed with parents before, like just being there for them and answering any questions they have, just to make the journey go by more smoothly. And that's pretty much it. So hope this was informative, and thanks for tuning in.